There's nothing more frustrating than hand pain, especially if you spend a lot of your day at the computer. But there are solutions, and here to share a new option that could give you relief is orthopedic surgeon Dr. John Knight. Welcome, Dr. Knight. So we're actually talking today about something relatively new, knuckle replacement surgery.
That's correct. Knuckle replacement is not for everybody, but for patients that have severe arthritis of the hands, limiting function, severe pain, deformity, this can be a life changer.
So it's an option, and we have a really cool animation here. We're going to walk everyone through this to show you exactly what happens in this procedure. So you're looking at a hand. Walk us through what we're seeing here.
The red line, either centrally or going crossways, is an incision through the skin. Once we go down to the joint, we're looking at the metacarpal bone and the phalangeal bone,
so
or the knuckle of the hand right there. And so we have to remove the diseased joint with a little micro saw that allows us to put a new joint in its place. So there we're removing one side of the joint with the diseased cartilage and the other side of the joint here. Now we're putting a little alignment guide in so we have good alignment of the joint when it's put in. So it's parallel. And then this is a temporary implant for sizing. And then finally we're putting in a pyrocarbon graphite with carbon prosthesis, very strong prosthesis, and then this shows the wound after they're sutured up.
So hopefully everyone understands that, because literally if you had severe arthritis, say in this joint, you're literally getting rid of that joint, the cartilage, and replacing it with this artificial prosthesis. We have an example here of an x-ray. These three have the artificial joint. This is the old normal joint, right?
That's correct.
And this is the prosthesis?
Right. That's again, it's a very sturdy, flexible, solid prosthesis made of graphite and carbon. This is an example right here.
So that becomes your joint.
Right.
This small.
Yeah, very similar to a knee or hip replacement, but obviously on a much smaller scale.
And so after this is done, what type of mobility will you get back?
The mobility could be normal. I mean, obviously we don't promise that, but it's usually a lot better than what they had before. But it could be 90 degrees of movement, which is normal for these joints.
And we actually have a patient here, Lori, in our audience, who had a knuckle replacement surgery performed. Right, Lori?
Yes. I'm very happy with it. Before, I could hardly move it. It was very swollen and painful. And now I've got almost full movement back now.
And so, Lori, you're happy that you had this done.
It.
Pain levels have decreased significantly.
Yes. And it looks a whole lot better, too, than how it looked before.
And that's a great point, because you can get a lot of deformity in these knuckle joints. So who would be a candidate for this procedure, Dr. Knight?
Well, patients with any form of arthritis, osteoarthritis or degenerative arthritis is what most Americans are afflicted with that get arthritis, aging arthritis, rheumatoid arthritis, which is more of a crippling arthritis, and then what we call traumatic arthritis, just one joint from a fracture that didn't heal right can also lead to disabling pain.
Well, thank you so very much for sharing with us.
Thanks
we
for
really
having
appreciate
me.
it.
Thanks.